So it's a government plan. So in every district there are around 900 members in the state, and all 900 members are independent members, no government members. So everyone came together in the state, 900 members. So there are 30 or 40 members in the state, and we are assigned 1 or 2 or 3 districts. So we go to the district, government give us our travel support. We go to the district, we review all the programs, maternal death audit, we do neonatal death audits, we monitor the health services, and we give an independent report to the government. And based on that, we ensure that some actions will be taken place. So this is within that. There are also community-based monitoring. Each community is going to monitor the health services. What are the facilities should be available in the primary health care? It is the entire the community and the village people, it's their responsibility also to monitor. If you don't go there and you don't monitor there, the service is not going to be improved automatically. If you go and don't give a complaint that particular doctors are not coming and medicines are not available, nobody is going to listen. Officers on their own, they don't do 100% actions. Some of the time you have to also provide them information. Maybe out of 10 complaints, 2 complaints action will be taken. So this is also important that community take also the responsibility to monitor the health services and know about what are the health services. At least start collecting information about the health services. Like Telangana, you have already Clinical Establishment Act. It passed in 2010. Then new rules has come, I think 2021 or 22. New rules. In Supreme Court there is a petition going on about implementation of Clinical Establishment Act. But under the Act, you can demand from the government that display of rates should be there in all the public private hospitals of Telangana. You already have Act. Like Madhya Pradesh, in other states, many of the 16 states, there is no Clinical Establishment Act. It's the old Nursing Home Act. So if you act, you can demand. And if the government is as per the Act, you can go to court if they are not displaying the rates of the rates. You will get a major support from common people, from middle class and other people also. Because many are suffering from the high rates of the private hospitals. Next. So once this kind of act comes, many people ask what is the use of act? What is the use of law? There are many laws which is not implemented. So once the act comes, at least there are denial of healthcare, at least it minimized. Or you have a right to go to particular officer or some grievance redressal system or somewhere places when there is an act, you have a right to go with the legal act. Medical negligence cases, everything is going to the Consumer Protection Act. And it takes 5 to 10 years. When this act comes, there must be a grievance redressal system, there is immediately a speedy removal of any negligence case. Unethical practices are happening. If any government circular comes, which my complaint, the cancel of 21 doctor registration has been cancelled in Madhya Pradesh. The neurosurgeon has gone to Scotland with Intas Pharma sponsored trip to visit foreign trips. We got the ticket, we make a complaint to Medical Council of India. There is a simple order of 2012. Doctors can't visit foreign trips with pharma sponsored by pharma company. It's a rule. They have visited with their family members. Their license has been cancelled after 2 years. And 3 months, every day media goes to their house whether they are going to hospital or doing a practice of. They are the topmost neurosurgeons. What happened? There must be some control after this complaint. Out of 24 doctors were supposed to go. When the media took a news, 3 doctors cancelled their trips. We are not aware. They come to us for compromise. We said, you say sorry, we will take a complaint back. They said, we can't say sorry. We can give you money. Then you can come with the media and then say. Also there is irrational practices is happening. You don't want saline bottle for simple fever, but they put you saline bottle and take you 300 rupees. You don't want unnecessary particular test, they do that test. So when this kind of acts happen, there are also lots of rational treatment and ethical practice guidelines. Also there are many violations of health and human rights happen. So this will be, actually I am not telling it will be finished, it will be minimized. The number will get down. There must be something. There must be some fear. Today there is nothing. And it happens with 20 to 30% of doctors. This is also a fact. 60 to 70% doctors are doing their treatment very ethically, very rationally, following the guidelines. But nowadays people also go to those doctors, they do more tests and more medicines. My father has some mild BP, high BP and some attack. Gone to a doctor of neurologist, some C. So he has given 12 medicines. Alzheimer, dementia, depression, all the things. I purchased 7,000 rupees of medicines. I kept with the bill. I had gone to Pune, so to another neurologist who told me, who had given you, sir, this is. He will give me the case paper, it will be good for our study. He told me, no, nothing, no medicine required. So from Patna doctor and the Pune doctor, this is the difference. There is a difference. And after that, I had gone to the doctor after 3 months. Are you returning these medicines, paying me this money, or can I go to court? You are also a known doctor. You don't know medicines, so you ask with the medicine shop. No, it's your medicine shop. It was your hospital medicine shop. You ask. So this is also happened. So this is the next. So once we do, the monitoring will increase, and also about mentoring will increase. Also this all government and political body, judicial, media are responsible for providing universal health, ensuring health care. The responsibility of the government and the policy maker also increase when we have some kind of also accountability increased between the public system. Few doctors don't go to hospitals. That's also a fact. In the hospital time they do a private practice. This is also a fact. But due to that, everything is bad in public hospital. This is the perception is also not correct. Under this perception, many things, irrational things happening in private hospitals, which is nobody talked about this. So also about this when we say, and also it's not, the civil society role is not to duplicate the government efforts. It's also to bridge the gap. Where government is not doing certain things, we need to highlight that things which is government is not doing. Next. So yesterday I was talking about Right to Health Act. I was talking about affordable health care, available health care, accountable health care, accessible health care. When the act like Right to Health or any act or Health for Act, All Act or anything comes, so this will, you will get an insurance that this you will get it. This is the draft of our Madhya Pradesh Act what we have written. Accepted by the government and accepted, it was supposed to be passed in the parliament, the government has withdrawn. But this, and also about, yesterday I was talking about health for all means what? Health for all means women, children, laborers, prisoners, LGBTQ, senior citizens, disabled, other vulnerable groups, everything. You need to plan a separate health plan for tribal areas. You can't be a normal health, general health plan. If the tribal areas have a separate health problems, you need to have developed a tribal health policy or a tribal health plans for the state, for selected districts. It can't be one program for everyone. So also about Article 39 also said health and strengthening of all workers. There are lots of workers issues, occupational health hazards and all that. Next. So also this kind of act, Assam has a public health act, Rajasthan has public health act now. Now people are demanding about free medicines and other thing in the government hospital after the act. There were 15 to 20 days opposition by the